In Health Matters, we want you to know about an autoimmune disorder that can suddenly change a child's behavior in a scary way. Some studies show that 1 in 200 kids has it, yet few people know about it. A local doctor is sounding the alarm so that parents understand PANS and PANDAS. A misdiagnosis can lead to death if not treated correctly.
6-year-old Noah has come a long way since being diagnosed with a rare autoimmune disorder. At the time, she was a happy and healthy 2-year-old, but got sick and spiked a fever, then started acting clumsy and falling. Later that night, terrified her parents.
It's a very blood-curdling kind of scream. We knew it wasn't a normal, like, I'm scared scream. And we went to get her out of her bed, and she had lost kind of control of her limbs. She couldn't walk.
Noah was diagnosed with a condition called PANS, which stands for Pediatric Acute Onset Neuropsychiatric Syndrome.
Everything that we knew she was gone. There was this crazy fear and anxiety. And when I say fear, I can't describe the depth of that, like noises, sensory processing type things. A piece of ice hitting a glass would make her have a full-blown panic attack that would take hours to recover from. And that all literally happened overnight. So it was kind of wild.
Lindsay says she feels fortunate that Noah's pediatrician, Dr. Paula Krupstad with Hope for Healing, is actually an expert in this. There's not just one test to help diagnose PANS. It typically takes going through a checklist of symptoms, often beginning with obsessive compulsive behavior, major fears, or severe restricted eating, with symptoms in at least 2 other categories.
There can be physical findings such as children feeling like something's on their skin, or they'll have tics, motor or vocalizations. They have abnormal movements all the time. They'll just be wiggly. These are also hyperactivity. Sound hurts their ears, their eyes. Bright light hurts their eyes.
The list goes on. Messy handwriting, dilated pupils, bladder issues. Strep throat is what sparks PANDAS, while PANS can turn up after a number of illnesses. Noah was exposed to toxic mold before the PANS diagnosis, so doctors suspect people who can't handle the load of toxins in our environment may be more vulnerable to PANS. Treatment can be tricky. Dr. Krupstad says infection often lives in the tonsils.
So tonsillectomy, adenoidectomy, homeopathy, functional medicine principles, the most power people have is in their kitchen. When they remove animal dairy from their diet, casein binds to folate receptors in the brain, and it impairs neurologic function. So you take dairy out. We're not baby cows, sheep, or goats. You take gluten, which is inflammatory, you remove that. You work on sleep. You get these kids moving. You don't allow them to be isolated. If they're severely anxious, you need to be careful. And if you need psychiatric care for a time, that's can be added too.
Noah is now thriving because of her quick treatments. Getting the right diagnosis is imperative to make sure kids are safe.
It's very important because this is ongoing brain destruction, and if you don't address it, it could lead to death.
Yes, it is absolutely associated with suicide in teenagers. And on that note, another family feared they would lose their son over the diagnosis. We'll talk to them next hour at 9:30 and share resources about this with you on our Fox Local app.